Hi everybody. Today I have 5 tips for you on how to stop touching your nose. We're continuing our video series on how to stop touching your face, broken down by nose, eyes, mouth, and the rest of our face. In this COVID world that we live in, the most important thing you can do to keep yourself safe is to wear a face covering out in public. Follow closely by washing your hands frequently and stop touching your face. The reason why is that we go out in the world and we touch common surfaces that are covered by dirt, bacteria, and viruses, and then we bring it to our face, and often that's how we get sick. So let's protect ourselves. I'm Dr. Rachel Johns, an internal medicine doctor specializing in hospital-based medicine in Southern California. My passion is educating patients on healthcare topics that matter most to you so that you can live your best life. We're talking a lot about COVID-19 these days, and there's a lot of misinformation out there. I'm here to give you the latest and most accurate, up-to-date information, the latest on scientific research, and we'll dispel some myths. Please subscribe to my channel so you don't miss any of this important information. So in the first video, we talk about a little bit about motivation to help change bad habits into good habits, and how do we become conscious of something that we don't know that we're doing, and how do we keep track, and how do we stop touching our face so often. So please look at that first video, and then we'll move on to the tips and tricks for today of how to stop touching our nose. So tip number 1 is the same. We need to change the way we sit or stand. If we're sitting behind a desk or standing behind a counter, then our elbow comes up on that surface. And then, lo and behold, your face is in your hand, and then your hand goes all over your face. So instead of doing that, let's put our hands together. So if your hands are holding each other, then they're not on your face. We can keep them down in our lap. If you're standing, you can put them behind your back. If you need to, you could even sit on your hands. Tip number 2 is to keep those hands busy with something else. You can use a fidget spinner, you can use a stress ball. Some people like to do a bead bracelet, and then you can, roll those beads around in your fingers. Just something that keeps your hands occupied, so again, they're not on your face. Tip number 3 are for those of you who have allergies that causes runny nose or itchy eyes. It might be time to start a medication. There's a lot of over-the-counter medications that are very safe to use. Some of them are nasal sprays, some of them come in pill form. Please ask your regular doctor which one would be best for you in consideration with all of your other medical problems. If medications aren't working for you, then it's time to get a handkerchief or keep some tissues handy so that you're using that to wipe your nose, not the back of your hand and not your shirt. Your mom probably told you not to do that when you were a kid, right? Tip number 4 is to moisturize your face. The nose is covered in skin, and dry skin gets itchy. So a good idea would be to moisturize, use some lotion twice a day when you're doing your morning and bedtime routine. Hopefully you've already washed your hands before you're going to brush your teeth and floss, and then use the lotion to moisturize your face so that you're not scratching during the daytime. Tip number 5, since we're talking about our nose, you know I was going to say it, don't pick your nose. Okay, this is a bad habit that is born out of childhood and sometimes follows us into adult life. Again, this is time for the handkerchief or tissues. Handkerchiefs are pretty cheap nowadays. You can get them for about $1 a piece. Keep some tissues handy at your desk. Just keep one in your pocket and use that to blow your nose. Keep it nice and clean so that it doesn't bother you during the rest of the day. So those are the tips and tricks I have for you today on how to stop touching your nose. I would love to know which one of these worked for you, and if they didn't, I'd like to know that too. I'm Dr. Rachel Johns, and I'm here to help you control your medical problems so that they don't control you. Bye.